Good afternoon, everyone. My name is Lisa Wright, and I'm the president and CEO here at Community Health Choice. And I am grateful for our panelists today, trusted health leaders across Texas and the nation. First, let me do some introductions, and I'll start with Elena Marks, who's the president and chief operating officer at Episcopal Health Foundation, with a strong focus on data and policies for our overall health and well-being. Next, we have Aurora Harris, who's the Southern Regional Director for Young Invincibles, with a focus on mobilizing young adults for issues including healthcare and coverage. Next, we have Melissa McChesney, who's the Senior Policy Analyst for Every Texan, a statewide advocate for policies that work to create a better Texas. And last but not least, we have Kay Garamani, the President and Chief Executive Officer of the Texas Association of Community Health Plans, an important advocate for our health safety net system. Community Health Choice has been honored to partner with these leaders and their organizations in community service, outreach, education, and advocacy. Thank you, ladies, for joining us today. Erin, would you start us out by launching our first poll? Okay, before we get started, if everyone could take a moment to answer this poll, how much do you know about the special enrollment period and APTCs? So we have some experts, which is really good. I wrote the book about them, about 8%. I think that this has to do with enrolling for health insurance, about 40%, and not much, but hoping to learn, 52%. Well, for those that are trying to figure out if this is enrolling in health insurance and those that are here to learn, we are definitely here to share our knowledge. And so people are really excited about the recent national legislation that the American Rescue Plan that can help Texans purchase health insurance at lower monthly premiums, in some cases as low as $0 for full featured health coverage. The savings are significant, and today we're going to learn more about how to help Texans get covered for less. So first, let's start with the big picture of health coverage landscape here in Texas. We want to ask Elena first and then Melissa, what does health coverage look like in Texas? And are there demographic trends for people who don't have coverage? Elena, let's start with you.
Thanks. Health insurance coverage looks dismal in Texas. We have the highest rate and the highest number of uninsured people in the country, and we've had that terrible distinction for a while now. Before the pandemic in 2019, our uninsured rate was 18.4%, twice the national average. For our kids, it's 11%, also twice the national average. And then we went through COVID job losses. The estimate in May of 2020 was that for adults below Medicare age, so 19 to 64, 29% were uninsured as of May of 2020. And there's data that shows that as many as 37% of that same pool may have been uninsured as late as December of 2020. So we were in a bad situation, and it has gotten worse during the pandemic as people lost jobs and lost the health insurance that came along with those jobs.
Well, Melissa, what would you add?
One thing that I would add to this is that prior to the pandemic, starting in late 2017, we were actually seeing huge disenrollments for children from our Medicaid and CHIP program, which about half of Texas kids get their insurance through the Medicaid program. And we saw, according to data from our state Medicaid agency, about 237,000 kids, fewer kids enrolled right as the pandemic was starting, so March, February of 2020, compared to where we were December of 2017. A big reason for that is some of the immigrant policies that were passed under the Trump administration, specifically regarding what's known as public charge. So these created a fear in our non-citizen communities and mixed status families about using government benefits, which again is a huge part of how kids get insurance here in Texas. So that's why we, when Elena talks about having the highest uninsured rate, not just overall, but also the highest uninsured rate for kids, that has certainly gotten worse since 2017, according to the data. So we came into the pandemic with a problem, and then we added on to that, high unemployment and not a ton of people then becoming eligible for coverage, since we lack options here in Texas.
Yeah. And so I appreciate that. And I just want to thank you all for highlighting the fact that, the uninsured rate here in Texas, unfortunately, leads the country. And so as we sort of reflect on that and think about the recently passed American Rescue Plan, ARP, which now can provide additional savings for people who can purchase health insurance coverage on the health insurance marketplace. And the Biden administration has announced a special enrollment period that began March 15th and now is going to run through August 15th. We're going to start with Melissa and Aurora, but Melissa, how do you think that this new law and the SEP will impact Texas? And if you could also speak to the uninsured rate.
So the big takeaway from this is that coverage through the marketplace has just become considerably more affordable for everyone who is eligible for that coverage. And we're seeing some new income demographics becoming eligible. So for those already eligible for coverage under the ACA marketplaces, so from the poverty line, so 100% of the federal poverty line up to 400%, the law has greatly increased the amount of help that goes for people in paying their premiums every month. So people who are already in the eligible range will see, if you're already enrolled in ACA coverage, you'll see your premiums go down. If you aren't enrolled in coverage, maybe because it was unaffordable, people should check again, because it now has become considerably more affordable in those income ranges. And then there's an entirely new group that is now that wasn't eligible before, and that's folks above 400% of the federal poverty line. It's been known for a while that that this income range in the middle income, that while they certainly make more than folks at the poverty line, they still didn't make enough to pay full premium costs, especially if they're older, because that is one thing that can impact how much premiums you're paying every month, is just your age. So now anybody above 400% of the federal poverty line should not be paying more than 8.5% of their income toward their insurance. Before, it could have gone considerably higher, as much as 20% you would have been expected to pay. So it's such a big change, and we're really excited to see that for the 2021-2022 plan year coming from the American Rescue Plan Act.
Yeah, thanks for that. And then Aurora, for you and the Young Invincibles, what's the difference about this SEP that you're seeing?
Yeah, I mean, I think everything that Melissa talked about can't be said enough about how much savings folks are going to get. Like Melissa mentioned, low income, and for us, we're really particularly interested in young people or young adults, are going to see plans nearly zeroed out in some cases. And then for the first time ever, right, like middle income people, like Melissa were saying, see some savings available to them through the Affordable Care Act. So that's really exciting. In addition to that, what's really different about this special enrollment period is that you don't need to show a loss of coverage or other major life changes that's normally required for you to sign up outside of the annual open enrollment period, which is really big for us because we deal with young people who like have to move for college, or maybe they had a baby, or all these other different life events that can qualify for them. Now you don't need to show proof of that or anything like that. Anyone can sign up right now through August 15th. So that's really different and a really huge deal for us. Another one is that starting early July, consumers who qualified for unemployment benefits at any point during the year will be able to receive increased savings through the Affordable Care Act, regardless of their income. So that's also really big for us, as Elena and Melissa were mentioning. So many folks lost their job and are struggling right now. And so that's also something that's really incredible. And then I think crucially, especially for young people that we work with, this is going to be paired with outreach and enrollment and advertising for the first time in 4 years, right? And so the previous administration cut outreach and advertising for the Affordable Care Act by 90%. The American Rescue Plan puts in like $100 million for advertising. And so we can talk about these incredible savings all day, but for us, if like young people don't know about it and don't know that this even exists, it's not great, right? And so this is incredible that we have these incredible savings, plus we've got some advertising dollars that can really help this go a long way. So for us, those are some like crucial things that are really different about this, and we're excited to kind of take those opportunities.
Well, Aurora, I really appreciate that. And I will tell you in the chat right now, there are a few questions that are being asked about how do I get access? Where do I sign up? So Erin, if you in the chat could put a link for people on where they can get more information around how to sign up, that would be great. And so Helen, I've heard your questions. We will get that out to you for you and your group. And so Kay, what roles do community plans play during an SEP?
A community health plan, just as a little bit of background, is a plan that is affiliated with a nonprofit or public health system in Texas. So it's different than like United or Blue Cross, which are, we call those national companies. Community Health Choice is the largest community plan in Texas that does marketplace business, and they are really a leader in terms of the outreach that they do, the community development and community relations, and really commend Daisy Morales and Lisa both for all the work that they do. And so they've been doing a lot. I've talked with Daisy about some of the things that they're doing, and she'll allow me, I think, to highlight some of those. And I've talked with our other marketplace companies as well. And there are 4 of the community companies that do marketplace business. And they are being very proactive in making sure that if somebody calls into their call center and they need assistance to figure out what is really going on with these new special enrollment periods, you know, or if they can get the increased subsidy, that they can help walk them through the process. So you could either go to Community Health Choice and get them to assist you. You could also go to healthcare.gov directly, which is the federal site portal where you can go in and you can apply. So either way, it works, and you're going to get a lot of good customer service from Community Health Choice. They are trying to, you know, part of this video here is to educate people so that you guys know what they are and kind of where to go. Just a lot of messaging through different social media, you know, reaching out to members that are already enrolled, and also trying to make sure that the larger public knows, because as Aurora said, this is the first time really that these special enrollment periods don't have all of the qualifications attached to them. So we want to get as many people insured in Texas and make sure that healthcare is as affordable as possible. And that's why the American Rescue Plan and the provisions in there are really exciting. So we want to make sure everybody takes advantage of them before the enrollment period ends August 15th.
Yeah, and affordability and why this is important is really huge. And so, Elena, you talked earlier about just the rates of children and adults, and we know that people without health insurance are less likely to have access to overall health care, which deepens the health inequities many Texans face. And Episcopal Health Foundation recently shared data that health inequities cost Texans more than $7 billion. And so can you really help connect the dots for people about what that really means financially?
Yes, it's a huge problem for the people who lack health insurance. They lack access to health care. And so it has devastating effects on their own lives, including their health and their employment and their productivity. But what the study we commissioned showed is that it also affects all of us in the entire economy. And so it's really important for everyone to be insured. And we have great disparities between white and non-white populations in terms of health insurance. And if you take those into account, what the study showed was that the mortality rate during COVID for people who were Hispanic was 80% greater than for people who were white. And for Black people in Texas, it was 30% greater than for people who were white. And that translates into loss of years of life and years of productivity. And that impacts the entire state. So it's devastating for the individual and their huge personal and financial costs, but we all pay a price. And what this study showed is that the spending, if we had the same health outcomes for Black and Hispanic Texans as we have for white Texans, we would actually reduce healthcare spending, excess spending each year. We would increase productivity, and we would reduce premature mortality. So it matters to the people and it matters to all of us because they're our fellow Texans.
Wow. Thank you so much for sharing that. That's really important news. And not only for just, each of us that are on this today, but then just thinking about Texans altogether. In our current media environment, which can be, chaotic at times, there's so much going on in the world. How do we spread the word and encourage Texans to take this opportunity for better coverage? Or Aurora, you spoke to this a little bit ago. So let's start with you and your organization and what your plans of action are.
Yeah, I love this question, right? Because we're still in a pandemic, and so that's top of mind for everyone in terms of the news. We've also got the Texas legislature that's also top of mind, and there's new bills and legislation and things coming all the time. So the news cycle right now is going to be covered in lots of different things. And so how do we cut through that noise? I think for us, we've really found that peer-to-peer outreach has been really helpful. So we hire young adults, college students, to do health insurance literacy trainings to their friends and on their campuses, and sort of like recruit as many other young people as I can to just teach about what is the Affordable Care Act when you hear that in the news? What is a premium tax credit, especially if you're a young person or a young person of color, like Elena was mentioning before, a marginalizing person who hasn't had access to this traditionally. And so we do a lot of that work. We also work with our community partners to do things at a larger scale, like billboards across the city, to sort of make up for the fact that the previous administration wasn't doing a lot around advertising. And so we do some of that work with our partners. And then if you're on the call and you're an advocate or a community partner doing this work, definitely encouraging you to get creative. Like we've got partners in Houston Change Happens who've done book bag drives, and they'll put in, flyers right around maybe community health choice and the different plans that might be available, or how to like sign up and get in-person virtual assistance, right, to help you sign up for a plan. We've also seen colleges do really cool virtual resource fairs, letting people know about these opportunities. So we're definitely encouraging people to still do that person-to-person virtually outreach as much as they can, because we found that, especially for young people, to be the most impactful, because they have a lot of questions, right, around what does this all mean? How much is this really? Okay, well, what's the deductible piece? What's that, right? And so we found that those in-person connections are really, really impactful. And then I think some key messages that are really helpful that we've seen is, one, that healthcare.gov is open in the first place. And that if you're uninsured and you want coverage, it's there, it's available for you. Healthcare.gov, always, lifting out that website as much as you can. And then two, definitely emphasizing affordability. I think no matter what age a person is, everyone wants to know, is this actual affordable to me? That's the biggest criticism that the Affordable Care Act or Obamacare has ever gotten, is that it's not really affordable. And so using specific numbers, right? Like 9 out of 10 people get a plan for, less than $50 a month, or like 4 million people will qualify for a $0 plan. Like using very specific numbers is really effective. And then lastly, I'll say, I don't know if this is just young people, but a lot of people love social math too, a little bit. So like you can get a plan for the same cost as a latte, or or your phone bill or something like that, just so that people can kind of compare where that would go in their budget, is something that's really helpful too.
Wow. Thanks for sharing. Those are really helpful hints. Good way to relate sort of that affordability with what we spend each day. And so, Melissa, you're a policy analyst, but you're also involved in grassroots outreach. And I know that you've been helping answer some questions in the chat. And so, what are you seeing in regards to, I would say, not only how people are spreading the word, but some of the calls of action to really get people to sign up?
Great. One of the things that we've been involved in at Every Texan is actually outreach to folks who are on unemployment insurance. Again, as Aurora said, I want to make it clear the functionality in the website for that particular provision will not be live until July, but it's important to let folks know now that this is something that will be available to them. So come July, if someone in your household, so again, those are tax households, since this is all related to your tax credits. If someone in your tax household got unemployment, this is going to sound more generous than you can even wrap your mind around. For even just 1 week in 2021, then everybody in that tax household is eligible for subsidies as if they were at 133% of the federal poverty line. And what that means in real dollars is that they're going to get a $0 plan with very high coverage of their out-of-pocket costs. So they'll very, very low out-of-pocket costs for the consumer themselves, and everybody in their household is eligible. Again, they won't be able to see that savings until July, but that is there. And so we've done some outreach with TWC. They've actually sent an email already to every single one of their recipients to let them know that this is something that's available. So that's something that we're really excited about getting the word out on, is that just extremely generous plan. And one thing that's just to sort of tie together some of the stuff we're talking about. One, we know that Texas has not expanded coverage under Medicaid. So a lot of folks below the poverty line can't get health insurance. And that became even more significant during the pandemic because people lost their jobs, and depending on their household structure, their unemployment insurance may not have been enough to make them subsidy eligible. They may have been getting not enough money to get over the poverty line. Well, for those folks, they can now come into the special enrollment period and they'll be eligible during 2021 for that premium assistance. So, getting that word out on the ground level in the Gulf Coast region. Enroll Gulf Coast has been working in this region since the Affordable Care Act started. Aurora mentioned, she's been part of that coalition since its beginning, even before she was with Young Invincibles. Change happens. All your community health clinics, those are places where you can go and get information. Of course, anybody that's currently enrolled in the community health choice plan can get the information they need from your health plan as well on how to make sure that you're seeing those savings. I think the last thing I just want to mention, again, this is in direct response to one of the questions. If you're already enrolled in ACA coverage through the marketplace, you do need to take steps in order to make sure you're seeing those savings now. If you don't do anything for the rest of the year, you're not going to see the savings until your tax return next year, which might work for you, but I bet most of you want to see that money back in your pocket right now. So if you feel comfortable doing it yourself, you can go to healthcare.gov. You just go in and you act like you're submitting a change. Now, if you do actually have a change in any of your income or whatever, go ahead and tell the website that. If nothing has changed since you applied back during open enrollment, then you can just submit that change. And what it does is it just kind of resets the website so that you then get those new savings on, and they should start in May. If you're in community health choice, my understanding is that y'all can help folks with that. So feel free to reach out to the health plan and they can help you get that savings applied as early as next month for current enrollees.
Yeah. And so, Melissa, definitely thank you for saying that. I know there's been a lot of questions, but just to reiterate what Melissa said, if you are currently enrolled in the marketplace and want to see the APTC savings, you will have to reapply. And so healthcare.gov, or if you're currently a community member, we can definitely help you, but you will have to reapply to see those savings. And so, Kay, what are you hearing from some of the community-based health plans here in Texas about how they're helping and what they're doing for maybe existing members as far as re-enrollment?
So the community health plans are great at member services. They are hand-holding people through the reapplication process or re-enrollment process. And they're just a great resource for answering questions that their members have, or just anybody from the community who calls in. Everybody ultimately does need to go to healthcare.gov. And it's really a nice website. It's set up so that it's, user friendly. I see some people in the chat are trying to get newly enrolled and haven't been in community health choice in the past. So you can just go straight to healthcare.gov. It walks you through step by step the questions that you have to answer, and they're easy to understand. It's really an easy process. But of course, if you do need some additional assistance, then Community Health Choice and their member services are available to assist.
Well, thanks for that. And so for you, Elena, the Episcopal Health Foundation has a dual perspective on this, from the view of not only the churches and the ministries, but also a data and policy view. So any additional best practices that you're seeing or that you're hearing about that you'd like to share?
Well, from our perspective, it is all about really what Aurora said, and it's getting the message out. And we do that really by funding these groups. So Every Texan and Young Invincibles are both grantees of ours, and we fund a lot of other groups that are very grassroots oriented, and they have relationships with all different populations, and they are the best to communicate with them, whether they hear it by text or peer-to-peer or all of the other mechanisms. We rely on the groups that have pre-existing relationships because they know their people better than we do. And we have found that to be really the most effective avenue for us in terms of getting the word out. On the data and policy side, we try to support the production of data. Sometimes we do our own studies or commission studies and support the development of data that way, but we try to couple the data with the action. So how do we make sure information is available, and then how do we make sure it gets to the right people at the right place in the right time and from the right messengers?
Yeah. All really good points. And so we've talked about, a savings, but let's actually take a real life example of what this cost savings could mean to folks. If Erin, if you could pull that up, because I think that this is important. So if we put this together to help people really understand what the savings could mean to them. And so if we look at member number one, and that person is a male, they're 34, their income is 21,600, and they're on the silver plan, and this is community silver plan. And their tax credit and savings $275, and their monthly premium today is $196.49. After they re-enrolled, their tax credit savings is now $353, and their new premium is $124. So a little bit over a $70 savings per month. And so what we're talking about, these are very real dollars when we're talking about what this means to people and why it's important to really, try to take advantage. And if you're a family, and if we look at the example of the member 3, they're a family of 3, the income is $42,000. Today, the monthly premium for that family is $759. They receive a tax credit of $1,500, but their new credit and tax savings, they would get $13.99. I'm assuming that's an additional $13.99, and their premium would be $478. And so they're seeing almost a $300 a month savings. And so the savings is really, real, and we want to make sure that people not only understand it, but also have access to it. And so, Erin, if we could go to the second poll for folks. And so we're going to just do a check-in and ask, do you need assistance learning how to enroll or re-enroll in a marketplace plan and take advantage of the new subsidies? So if we could take about 60 seconds and answer that question, that would be great. And Erin, let me know when we're ready. 55% said yes, they could use additional assistance or information on what they need to do to save money. And then 45% say they're comfortable with the next step. So this is great. This means that, the information that we've shared thus far has been helpful, especially if we think back to our initial poll. So Aaron, if you could close that for me, because I feel like we've talked a lot about APTCs, which are advanced, premium tax credits for those that don't know, but it all seems a little confusing, especially if you're not in health insurance or you're not as familiar with, marketplace and how that business works. So maybe Melissa, if you could very briefly sum up for us how APTC works.
Sure. So,
very briefly.
yeah, sure. I'll make it as brief as I can. Basically, you tell the ACA marketplace what you expect to make in this year for 2021 and what you expect to tell your tax return you made when you go to file it next year. And they take a look at your income, and they have a percent of your income in mind based on how much you make or how little you make. And so let's say you're at 150% of the poverty level. They're thinking, okay, you need to pay 0% of your income toward health insurance. And that means you're going to get tax credits right now to help lower your costs. That's how tax credits work. There is something that is paid through the tax process, but early. That's why they're called APTCs. That means advanced premium tax credits. That means we get them right now. And so that's the long and short of how tax credits work. And then on next year, when you go to file your taxes, they make sure that you got as much as you were eligible for. And if you didn't, they actually give you extra.
Okay. Thanks for sharing that. And so, Kay, not everyone who purchases individual health insurance qualifies for either subsidies. What are some basic ways that people can obtain individual coverage?
Well, you can get it through the marketplace, even if you don't qualify for subsidies. And that's a good place to go just because you'll know who are the companies that are doing marketplace. It's very organized, and a person doesn't have to do a whole lot besides just go on to the healthcare.gov website. Insurance companies do also have individual coverage plans, and an individual coverage plan just means that it's not through an employer or through a group. That's called group insurance. It is individual. So the individual is going out and seeking insurance. And so many of the health insurance companies do offer individual plans, and you can go through an insurance agent. That's probably the easiest and best way. You could even just go straight to Blue Cross Blue Shield, for instance, if you wanted to. But if you don't qualify for subsidies, if you don't want to go through the marketplace, through healthcare.gov, then you can seek that insurance on your own if you do not have group coverage through an employer.
Okay. Thanks so much for that, Kay. And so I know there's people that are trying to figure out, will I qualify? How will I get coverage? And so we actually have some scenarios for people that are seeking coverage without qualifying for cost savings. We know that there are plenty of Texans interested in qualifying for the highest savings and want to understand who the best plans are. And I think, as our panelists have emphasized, Texans have to submit an eligibility application in order to get qualified and receive their savings. And so we've received a variety of questions from either people who RSVP'd, and then we have some live questions via Zoom and our Facebook live stream. But one of the most popular questions we've received is, how do I qualify for savings? And so, Aurora, would you remind us of the eligibility process?
Yes, it's very similar to how Melissa outlined it, right? Basically, putting in how much you think you're going to make that year. And then sort of the website will kind of use that information to let you know how much savings you're going to get. I think the fact that this is a common question doesn't surprise me. And the fact that our poll said that a lot of people want to know more about how they can get savings didn't surprise me either. It's one of the biggest questions we get to working with young people. We often direct people to our Get Covered America website, which I'm always saying young people. People can enter in their zip code, and then they can get free expert enrollment help available to them. It could be done virtually. Some people are now doing it in person, of course, with a mask. So if you're interested in getting that, I'll also drop that link in the chat. These will connect you to the folks that Melissa kind of put in all across the state, wherever your zip code is. And you can get some assistance walking through that application and what your savings could be. And similar to what Kay was saying, these folks are experts in customer service. They've seen it all, mixed status families, speaking multiple languages, whatever you need. You might think your situation is really, really complicated. It is not too complicated for these folks. And so I'll drop that resource in the chat as well.
That would be great. That would be great. So another question that we have is, should I stay on my Cobra plan or should I switch to a marketplace plan? So I always think that this is a pretty interesting decision, particularly for individuals who lost their employer-sponsored health insurance during the pandemic. So maybe Kay, let's start with you. And if you could do a reminder of what Cobra is for people.
Sure. So Cobra is an acronym for a bill that was passed in 1985. I don't even remember exactly what it all stands for, but basically it is insurance that if a person loses their group coverage through an employer, they're able to pay for the premium. They have to pay the full cost of the premium. And generally, if you're working for an employer, you're getting some subsidization of the cost of the premium. But under Cobra, you are eligible for up to 18 months, in rare situations, up to 36 months, to get continued health coverage. So again, you pay the full cost for it. There is some relief in the American Rescue Plan for people who are using Cobra, where you can get some subsidies, and you would get those directly through your employer's health insurance. So that would be, I think, the place you'd seek what those subsidies would look like. However, they're going to end at the end of September. So it's really just a short period of time. And the marketplace is such a great place to get your insurance, especially now with the increased subsidies. So definitely, I think that if you're on Cobra now, you should still check out, go ahead and check out the marketplace, because I think that you may get a better deal there. And anybody correct me if I said anything incorrect.
No. Melissa, anything you'd add to that?
Yeah, so I think the one thing is that we did actually see more subsidies coming for Cobra coverage than we expected to come out of this bill. So it will be 100% paid through September. But again, it ends at the end of September. So I think often the advice that we give people to at least think through, sometimes Cobra is the best option for someone who is in the middle of a treatment. And they need it or gets a lot of health care. So, I just recently my son has high healthcare needs, has a very expensive, very complicated medication. Switching insurance, it can take a lot of time for me to switch insurances. And if we'd had full paid Cobra, I would have done that when my husband quit his job voluntarily at the end of the year to go on a garden leave. So I definitely think that there are certain situations where that is the consideration that's put into place. And it's certainly fantastic that we saw such high subsidy coverage, but I echo what Kay said. If you're not in a situation where, you really need to stay in your plan because you're in the middle of care, go check out the marketplace, because that Cobra is usually very expensive, and it's only going to be inexpensive through September. So I'd say go check out the marketplace unless there's a really high need for you to stay on that plan.
Okay. Well, thanks for sharing the information about Cobra. One of the other questions that we've received is, I'm currently today on a marketplace plan. I have my individual coverage through marketplace. So now I can go and reapply. What happens to my progress towards my deductible and my current out-of-pocket expenses? And so, Kay, maybe let's start with you.
Well, actually, I might not be the best person, but I think you can switch from like a bronze plan to a silver plan, correct? This is where somebody's going to have to help me out some. And you're certainly not going to have to start over. So it's, though your deductibles are based on a calendar year, none of that is going to start over. And with the increased subsidies, even if you go from like a bronze plan to a silver plan, you're going to get better coverage. You're going to have a lower deductible. And so you don't lose anything by going through the re-enrollment process to get the increased subsidy.
Melissa or Aurora, anything you'd add to that?
I can add to that. So if you're staying in the same plan, I saw that question come through. So if you're just re-enrolling, really all you're doing is telling the system to apply the new subsidy rules so that you get that increased savings. So there's no worry there about out-of-pocket cost if you're staying in that same plan. If you're staying in the same plan, but you're changing the level of cost sharing reductions that you're receiving, and so that's a little bit of a wonky term, but in addition to the help you get on premiums, you're also sometimes getting help on your out-of-pocket costs. And so if you change your out-of-pocket cost level, then it should carry over, but you should talk to your insurer, and Community Health Choice might know specifically what their rules are for their insurance. If you're changing to a new plan, but with the same carrier, you're not, so again, with the same health plan name, then you're not necessarily going to get those savings if you change to an entirely new plan. So again, you should talk to your insurance company about that. And if you change insurance companies entirely, you are going to lose whatever out-of-pocket spending you had. So I'd say before, if you have spent a lot already, make sure to talk to your insurance company to get a sense of what you might be risking when you change plans. But if you're just re-enrolling an exact same plan, that you can go do, and you should go do, so you can get your savings in May, because you won't have any risk of losing it under that circumstance.
Okay, perfect. Thanks so much for that. Can someone though, just really quick, we're getting a lot of questions about clarification on when we say re-enrollment, what re-enrollment means. Is it a new application, or specifically what are we trying to say?
You go to healthcare.gov, open your current account. Don't create a new account. Open your current account, and then you would actually act like you're reporting a change, and that will trigger that new application. It's not actually a new application. You should be, throughout the year, anytime you have changes in your projected income, you should go in there and report those changes. And that's exactly what you're going to do. You're going to go in there, and if you did have changes, report them. If you didn't have changes, you just leave everything the way it is. And what that does is it has the system rerun the eligibility rules that are built into the website so that you get those new savings. So go into healthcare.gov and act like you're reporting a change, and get that to rerun your eligibility. I hope that helps. Aurora, if you know more specifics about what it looks like on the website, please add on.
I was gonna say, I do wish we had screenshots. No, but that's exactly it. You're just re-enrolling and acting like you're reporting a change. Hopefully that makes sense to folks.
Perfect. So I'm going to go to some of the questions that we have received live. So one, and this is just for any of our panelists. One, can we confirm that all household members will qualify for reduced premium if one family member has been on unemployment?
That is correct. So, and when I say household, I mean it. I know there's a lot of definitions, and I'm not trying to label anybody's family, but they mean tax household. So, so anybody in your tax households, if you are all on the same tax return, then that's your tax household. So anybody in that tax household, they will get those increased savings from, even if only one person received UI, and it only needs to be for 1 week. So if only the first week of January 2021, someone in your household received unemployment insurance, then your whole household is eligible for insurance, a plan as if you had income at 133% of the federal poverty level. And what that means is a zero premium plan with really high coverage of your out-of-pocket costs. So the whole tax household.
Okay. And so sticking to maybe the unemployment, we received a question that people that are on unemployment are eligible for maximum premium credits. How does someone who is currently enrolled today in a marketplace plan let the insurance carrier or marketplace know that they are unemployed so that they are currently eligible for the maximum credits?
So we won't know the exact functionality until July. Just so you know, because I think what they're going to have to do is add some extra questions to that application, but it'll be a similar process to what we're describing to get the subsidies, the new subsidies that are available right now. So in July, you'll go into the healthcare.gov website, you'll report a change. We're hoping that we'll see some new functionality that specifically says, did you get unemployment insurance in 2021? You'll say yes. It'll give you those new subsidies. But again, it'll be July before we know exactly what the functionality looks like, and before that savings will be seen. But I want to make clear that even if you don't, you have to wait until July to see those savings. It is true that all of these subsidies are for the entire 2021 plan year. So anything you didn't get for January, February, March, when you file your taxes next year, you're going to get that extra savings back on your taxes, even if you're not getting it in those months that already happened.
Okay. Okay, thanks for sharing that, Melissa. And Aurora, earlier you talked about just the Young Invincibles and how they're helping to outreach and communicate. Can you maybe talk to us about how they're helping advise applicants on the immigration question around who qualifies?
That's a really, really great question. And I think, Melissa, you're also a bit of an eligibility expert, so you might be able to help me on this too. I do want to say that I think all of us in the advocacy space are applauding the Biden administration for coming out and getting rid of the public charge rule that was happening under the Trump administration, causing a lot of fear in immigrant communities around their immigrant applications. And so that's been incredible. And so our message has been to definitely always talk to community partners around this. We have great partners at Lone Star Legal Aid, Light and Salt Association, some really great partners that can definitely sit down with you and walk through the application, but that enrollment in an Affordable Care Act plan is no longer going to be sort of like held against you for those applications. And so we've been telling people to bring the necessary documents and things like that to their appointments when they sign up to sit down with an enrollment expert, but that it's not going to be held against you if you are to seek an Affordable Care Act plan for your any immigration applications, excuse me. And Melissa, I don't know if you have anything else to kind of add there.
The only thing I would add is that unfortunately right now, if you are truly undocumented, then you're not just ineligible for the subsidies, you actually just can't even purchase insurance. Not that it's affordable to purchase full price insurance but you can't purchase insurance on the website. That also includes folks who are here on the DACA youth. So if you are documented, because of again, this is just the way that the laws were passed. DACA was passed after the ACA. It did not get incorporated into the definition of who's eligible to purchase insurance and who's eligible for subsidies. So truly undocumented folks and documented folks are not eligible for subsidies. That does not mean that their family is not eligible. Their families may still be eligible, but those are the two folks that wouldn't be eligible. And certainly as an advocate, we want to see more solutions for those communities as we've moved forward to try to expand coverage.
Right, but if you're in the process of other immigration applications, this will not harm you.
That's right.
Yeah, those groups that Melissa talked about absolutely still don't have access, and we're definitely fighting to make sure there's a change there.
Yeah, and I want to say people have this idea that because this is a government program that it's only available to citizens. It's available to anyone here who is here under what's called lawfully present. So if you're a student on a student visa, you're here legally, and you will have those subsidies available to you. So don't assume that just because you're not a citizen, you're not eligible. You may actually be eligible for significant savings under this new plan. So go take a look there. The only people who aren't eligible are just those who truly are undocumented.
Thank you for that. So we have about 7 minutes left, but before we go, I want to take the time to really thank our panelists for a very insightful and inspiring conversation about how to help more Texans receive coverage. But before we go, I do want to get a closing message from each of our panelists about either the American Rescue Plan or enrollment or re-enrolling, just your final thoughts that you would share with those that are watching this today. And so, Kay, let's start with you.
Okay, well, it's been a pleasure to be part of this panel. I want to say that I think it's really great that Community Health Choices is such an advocate for its members and is for the community, and I'm trying to make sure that this very long and complicated law is better understood. You know, I'm still learning many of the features of that law. You know, I think that it's also, as Melissa was saying, it's generous. It's so generous that you can hardly believe that, you know, these new subsidies are available, this new ability to get coverage is available, but it is. And so we want to see as many people in our communities across Texas take advantage of it. And of course, go to Community Health Choice. If you have any questions, you just call them up on their member services line and they will make sure your questions get answered.
Thanks so much, Kay. Melissa, what would you leave us with?
I would say, again, the biggest hurdle to folks getting insurance is their perception of how much it costs. So even if you've gone on to healthcare.gov before and you thought, no, this is too expensive for me, go again. And if you don't feel comfortable doing it all by yourself, reach out to Community Health Choice, reach out to the local community-based organizations that Aurora and myself have mentioned, and we've put some things in the chat there. They do this every day. They can help you. At least take a look so you can realize how generous these new subsidies are. Don't let that be the hurdle, because there are folks out there who can help you find out really how much it would cost.
Absolutely. Aurora?
Yeah, I would just echo everything Melissa said, except for I would say when you looked before and it was too expensive, it probably was. And so it wasn't affordable for a lot of folks. We're going to be 100% real about that. But now it really is. And so I would just definitely encourage people to look again, like Melissa said, reach out to those community partners and help us spread the word.
Yeah, absolutely. And Elena?
Same. It really is true. It seems too good to be true. It's not, it's for real. And no matter what your prior experience was, give it another try. And if you struggle, call Community Health Choice or any of the organizations who are helping people enroll, because you can get really high quality coverage for an extremely reasonable price. And you owe it to yourself and your family to do that.
Yeah, thanks for that. And so before we go, we do have one final poll. So Aaron, if you could put the final poll question up. And while he does that, I just want to let everyone know that's been asking questions that we will get answers to all your questions and have those posted on our website for you. And so our final question is, are you going to enroll or re-enroll for health coverage at this time? And so now that you know more, you understand more about the subsidies, where to sign up, the assisters that can help you, are you going to enroll or re-enroll? And so, Aaron, if you can tell me when we're ready to share the answer, that would be great. Let's see. 9% says, yes, this is the perfect opportunity to enroll. 16% say, thanks, but I'm okay with where I am right now. And then 74% said, yes, I'm going to re-enroll and see how much I can save. And so we hope that not only will you take the time to re-enroll and see how much you can save, but just continue to spread the word. And so this webinar, of course, we've recorded it and it'll be available via YouTube, links on our website at communityhealthchoice.org and our Facebook page. Again, for everybody that asked a question, we will answer all your questions and put those on our website. So thank you again to all of our panelists and our facilitators and to all the people who RSVP'd for the Zoom and joined us not only on Zoom, but also on Facebook live stream. Thanks so much and have a great rest of the day. Bye.